Surgeons, what was your oh crap moment? I was doing a corneal transplant when I had the oh crap moment. So during surgery, I replaced it with a new donor. Before I could get the new one on, there's literally nothing on the front of the eye except a tear film and aqueous humor. Anyway, the patient takes that moment to start retching. The reason we tell everyone to skip food and drink is so they don't aspirate in case they retch up. This patient lied about eating breakfast and started messing up everything. The eye is still open sky at this time. Those not in the know will say this is not good. Those really in the know will say, oh crap. Anyway, I had to grab the new one and start stitching as fast as I could on a patient actively retching up. I used 10x0 nylon sutures, which are thinner than an eyelash. It turned out okay, but not great. Don't lie about eating breakfast before surgery, folks. All right, so when your patient turns your surgery into a live-action horror movie, yikes. Story 2. Doing a C-section for this poor mom who'd been in labor for hours. Baby wouldn't come out the hole we'd made, so more pressure was applied. And suddenly, whoosh, baby zooms out like a torpedo. The baby's foot was caught by the nurse, who whipped her up in the air upside down like in old cartoons, but almost dropped her again. Thankfully, the midwife was ready with a towel and caught the baby to wrap her up. Mom and Dad seemed to think this was normal practice and didn't notice, but me and my colleague just stare at each other with a look of absolute horror. It still makes me shudder to think how close the baby was to hitting the floor head first. Never happened before or since. Story 3. When I was a new RN working the ICU in a large teaching hospital, I came into work one morning to a patient that was admitted that night, intubated, sedated, Foley catheter and all. Long story short, he was extubated, breathing tube out, that same shift and was completely alert and oriented. He was an end-stage renal patient, meaning his kidneys didn't work and he needed dialysis, and was only in his late 30s. Said he never made whiz anymore and didn't need the Foley catheter, so he wanted it out because it was hurting. Now, the catheter bag had been empty my whole shift, which is normal seeing as how he didn't make whiz anymore, and this hospital had a nurse-driven Foley removal policy, meaning while we needed a doctor's order to insert one, we could remove one at our own discretion, unless a doctor specifically put in orders not to. This patient had no such doctor order, so I went to remove the catheter. They are held in the bladder by a balloon on the end that is inflated with 10 milliliters of saline. I deflated the balloon, removing 10 milliliters of saline, and pulled it out. As soon as the catheter left, stuff started pouring. Turns out the nurse who placed it on admission hadn't advanced it far enough, since there was no production to indicate correct placement, and had inflated the balloon, causing trauma. It would not stop. I had to hold this man's thing shut to put pressure on it, while my coworker paged the resident who came and looked at me with pity as he told me to just keep holding this 30-something-year-old man's thing in my hands until urology could get there to assess. For over an hour, I held this man's thing and tried to make polite conversation until the urologist arrived. Story 4. Not a surgeon, but was working in an obstetric theater in the UK mid-heat wave last year. This is important as maternity wards are kept quite warm as newborn babies aren't good at regulating their temperatures. Combine this with a heat wave and the fact that in Britain we're not exactly used to high temperatures and we have the perfect storm. Mid-emergency cesarean, the scrub nurse assisting the op starts feeling faint. This is unusual as the scrub nurse worked in these theaters full-time, so this was her bread and butter. So I can only conclude it was the heat. She has to step out, so the SHO takes her place, assisting the OBS as registrar with a section. This SHO looked extremely junior, as in the first section ever, and they were trying to assist with the instruments when they fainted. I had to jump in and grab the back of their theater gown to stop them, and then sort of gently tug backwards to let them fall into me when someone else had taken over assisting. This SHO was not exactly small. Thank God the baby was already out. Story 5. When I was younger, I had a rather complex external fixator cage applied to my leg. It had 3 rings, 2 large 360-degree rings around my leg, one in the upper middle of the shin, one in the lower, which had humongous rods to keep the cage fixed to my leg, and a third one which was a horseshoe-type ring around my ankle, which threaded all sorts of pins through my ankle. Each pin was set in a certain way. The point of this external fixator was to relocate and fix the positioning of my ankle so it wouldn't be messed up, basically. I have had a birth defect called Talipes clubfoot equinus. A lot was removed before the fixator was put on, so this way it could all grow. It was a 9-hour surgery, and my doctor, who I won't name, was pretty chuffed with himself after seeing it all installed on my leg. This was until he looked closer. The pins I spoke about before with the numbers on them, almost like those sizing things on cheap coat hangers, were all colored and numbered except for my dad to do every morning and night. He was looking at the pins and the numbers. He glanced away and looked back with a stressed face on. After a few seconds and a slight hand-on-head gesture, he whispered, "Crap." In his mind, he had organized the pins in an incorrect way, and he was stressed beyond his mind for a few minutes. He was worried he had messed everything up. Luckily, he hadn't. He just needed to move 1 or 2 numbers. 1 year later, 8 months after the frame was taken off, which was in for 6 months, I ended up having my leg gone. The surgery didn't work how we wanted it to, or at least how I wanted it to, which we were sort of expecting. The goal was to get me walking. The removal got me running. Now, bear in mind, the removal was my call. I was 12 when it was done. Best decision I ever made. Story 6. 50-year resident here, there are lots of bad oh crap moments throughout training. However, I'd like to share a recent positive oh crap moment. 15-centimeter kidney tumor with thrombus into the vena cava. My attending and I are dancing around the aorta and the vena cava, and we're able to feel the tumor thrombus in the IVC. I was expecting that we need to cut and clamp the vena cava to get all the cancer out, but my attending literally squeezes the tumor out of the vena cava back into the renal vein, and then has me tie the renal vein off so the tumor doesn't slip back into the vena cava. Patient went home in like 4 days, margins were negative, and is still doing great. First time I felt like, oh crap, I'm a surgeon. Story 7. Heard an oh crap moment as a patient on the operating table. A couple of years ago, I was in labor for 28 hours, pushing for 6, when my child started showing signs of distress. He had a slightly elevated heart rate, and I had the makings of a fever. My midwife at the hospital told me the doctor was coming in to check to see if a vacuum assist could help. She checks me and immediately stands up with red liquid on her hand and says, "We're going to the OR now." At that time, I started feeling that zoomed out tunnel vision I know is shocking. I had anxiety, but figured she knew what was best. She did. We got in the OR 8 minutes later, and when they opened me up, I heard the surgeon say, "Oh crap, look at this." They saw stuff in my catheter bag and found my son was actually trying to come through. They got my son out. Those moments where he was stunned and not crying were an eternity. He cried and was born a completely healthy baby. After I woke up and was back in my room, the doctor came in and told me what happened. I knew it sounded bad, but oh damn, I Googled and started having a massive anxiety attack. It is extremely rare and very dangerous. I read from the time it happens, you have about 15 minutes before the baby is gone. When I went back for my post-C-section follow-up, my midwife let me know, as a practice that's been around 35 years with over 30 midwives and doctors, they had never once encountered that, and it was such a big deal for them. A few days after my birth, they all got together to discuss my case. I was so incredibly fortunate I chose to labor in the hospital that the doctor just knew from my vitals and baby that something was off. They just didn't know until they got me open. I can't even tell you how grateful I am for Dr. S. You saved my life and my son's life, and our family will forever be grateful. Story 8. As a patient, I hope if the oral surgeon is on Reddit, they posted this story. Wisdom teeth removal, all 4 impacted, gotta break out the heavy hardware. I'm knocked out, don't even know the dentist entered the room. I wake up but not able to move, just eyes open awake, but my limbs won't react to my brain. I can feel the dentist hammering a chisel into my tooth to break it for extraction. My eyes are wide open, jaw even wider with some evil metal contraption. And I'm staring at the assistant, begging for her to see me, and she glances over and drops a suction, jumps up and shrieks. The dentist stops to look at her, then looks at me, and I see him say, "Oh crap." Next thing I know, I'm waking up post-surgery. Crap that nightmares are made of. This was a military dentist. Yes, they put me under and no insurance involved. Not sure what they use for anesthesia. Yes, I could feel pain from the impact, but not nerve pains in the actual tooth. Story 9. I work in cardiovascular, and I can think of a couple. In my 8-year career, I've had 3 patients start moving their arms in the middle of open heart surgery. One of them even tried to sit up. The surgeon was literally pushing the patient's shoulders down and yelling to anesthesia to give the patient something. Another time, a simple pericardial window. For different reasons, sometimes patients can have extra fluid build up in the pericardial sac that surrounds the heart. The surgeon made a small hole and stuck it in to suction the fluid out and make room for the heart. He stuck it in too far and stuck it through the ventricle. He had to quickly open up more so he could stick his hand in to plug the hole with his finger. We had to call another surgeon in to help quickly crash onto the heart-lung machine. Story 10. When I was a surgery intern, I was pulled from doing scut work to help out in a crap show of a case. One of our professor emeritus in surgery was doing a simple liver biopsy on a patient and nicked her hepatic artery. The biopsy was for a recurrent tumor, and the patient has been on chemoradiation. What all that basically means is that the patient has a hole in a major artery, and her tissue has the consistency of toilet paper, so every time they tried suturing the hole, the tissue just breaks apart, leaving a bigger, more leaky hole. Pretty much all hands were on board. The chief residents were scrubbed in, the seniors were literally squeezing bags into the patient's veins, and us interns were runners going back and forth from OR to the bank to transport samples. We ended up transfusing over 40 units, 12 liters of samples, so the patient lost over 2 times her total volume during that surgery. A vascular surgeon eventually swooped in and did a rather slick patchwork that fixed the problem. Even better, the patient was like a daughter to the surgeon. He literally saved this patient's life several times already, and they got really close over the years. She even named one of their kids after him. The poor guy broke down a few times during the surgery and was convinced that he had just ended his daughter. The chief residence had to take over a few times when he was mentally not there. That was his last surgery. He retired the next day. Hell of a way to end a surgical career. Yeah, when the patient is more than just a patient, it hits a little too close to home. Story 11. Sorry in advance for this being so long. Not a surgeon, but my mom had to have a kidney removed due to her waiting for almost 2 years to go to the doctor about her pain in her back. The doctors found out it was a large kidney stone and that her kidney was infected, shutting it down. After draining the fluids through tubes over the course of a month and a half, she was finally ready for surgery. Cue last Wednesday, the day of the surgery. She was ready to finally be done with it. They removed the stent, put in, and the tubes were no problem. Next was the kidney. Here comes the oh crap moment. As they got ready to remove the kidney, there were complications. The kidney infection had spread to a portion of her lung and a major artery, making them fragile. As the surgeon removed the kidney, a hole was torn in the lung. At that point, it was a race to save her life and stabilize her. I don't remember much about how they fixed her up there, but they had to fly her to a different hospital and have a heart surgeon fix the severed artery in a more permanent fashion. Anyways, the heart doctor saw the grave situation and said she's got a 1% chance for her to make it. But he did such an excellent job that my mom is still alive and getting stronger each day. So the moral of the story is, if you have insurance and are experiencing pain, go to a doctor as soon as you realize it. You may save your own life and also save some doctors from an oh crap moment like this. Story 12. Former medical student here, rotating through general surgery was mainly an enjoyable time. I remember one young patient, 22 years old, was revisiting the ER where he'd been 6 weeks prior to sustaining some abrasions and bruises after falling hard off a skateboard. He was all scraped up everywhere but had healed up okay. But now he's in the ER again, feeling awfully sick and with a fever. As a third-year med student, I was dispatched to the bedside and hung up the CT films on the light box to much finger-pointing and grunting among the surgeons. I had no idea how to read a CT at the time and wasn't even really sure what part of the body had been scanned. So when the surgical resident barked, "Prep him for surgery," I was nonplussed, decided to disguise my ignorance and just go for it, as was the approved way for students at this busy public hospital way back then. We got him gassed and prepped and I scrubbed in. Surgeon said open and I raised the number 15 blade. He'd been prepped for a midline laparotomy, but I guess I exposed my ignorance when I spoke up to confirm the same. This was decades before timeouts, before wrong site became a never event, because everyone laughed. I opened and it went in uneventfully, reflected the omentum with its lovely arcades and exposed the viscera. You remember how to perform the kosher maneuver? The attending barked, "Yes, sir." "Well, do it." I slid my gloved hand up in the splenic flexure but met unexpected resistance. I peered up, seeing in confusion that everyone was edging away from the table. "What's the trouble, young man? Get your hand up there and complete the maneuver. Push harder." A spongy sort of barrier gave way, immediately recognizable as the locker room aroma of Staphylococcus aureus. The splenic abscess, doubtless caused by the transient bacteremia from his skateboard accident. The attending finished up with the splenectomy, and after some abdominal lavage, the patient was good as new. I had to throw out my shoes. Story 13. I was a fourth-year resident, and I was on call that day. Around 5 p.m., I went to do rounds, and as I got to the first room, I came in to find the first-year resident on top of the very recently neck-operated patient. That morning, he had a tumor removed from his parapharyngeal space. The resident was kneeling next to the guy's head with his hands and clothes completely covered in mess. I was instantly petrified. I went to OMG, I have never ever repaired someone's carotid artery. I am completely unqualified to help this guy. Someone please help us. I was the senior resident, so I was the only one on call at the time, and besides, none could get there in time to help this guy. He was passing out, so it was up to me alone to help him. So I took the guy to the OR as fast as we could, and I opened him up, all of the time praying and telling myself, it's okay, I can do this, I can do this. I was crapping my pants while everyone was looking at me to fix him. I opened him up and I saw the frickin' facial artery loose, so I clamped it, put a knot around it, and that was it. We closed him up, bandaged and transfused the poor guy, and I went to collapse on a stool. Story 14. I was a patient. It was a kidney biopsy. I was spiked up and out of it, but still awake. Laying on my stomach as my kidney doctor worked behind me, he warned me, you're going to hear a click and it will feel like Mike Tyson punched you in the back. Okay? I hear click, feel the punch, then hear, oh, crap, get so-and-so on the phone now. A nurse came up near my face to calm me and maybe keep an eye on me. I don't really remember everything. Apparently, he had nicked a vessel and I was at an alarming rate. I got to spend the night in the hospital. Never try to fit your kidney biopsy in on a Friday before the doctor leaves for vacation. Story 15. Not a surgery, but I did get surgery on the injury. I dislocated my shoulder, but it was an inferior dislocation, so the normal pull it back into place is the wrong way to pop it back in. It dislocated once before, like 6 months prior. The nurse kept insisting that she knew how to put it back in place. So she proceeded to pull on it for 15 minutes, all while I'm screaming in pain. I almost fell off the gurney and demanded a doctor. The doctor popped it in no problem, taught me how to do it myself, and had me sign papers that I didn't realize would release them of the liability of messing up my arm even more. My shoulder was so loose I dislocated it reaching for my wallet in my back pocket. I had reconstructive surgery about 3 years ago and now have a little less than 90% mobility in my arm and cramps and pain if I sleep on it wrong or reach too far or move it too quickly. This all happened when I was 17. And if you're learning a thing or two from this video, please don't forget to hit that subscribe and like button for more videos just like this. Story 16. Not a surgeon, but I have caused 2 surgeons to experience those moments. The first was when I went in for a sinus surgery, septoplasty. They gave me the anesthesia, wheeled me into the operating room, transferred me to the table, and started to prep me. I hadn't had surgery since I was 5, so I had no idea what was normal. But then they started to drape me and the surgeon walked in, fully scrubbed. So I decided to speak up and ask when I was supposed to fall asleep. Cue the panic from the nurses and the techs. The doctor just laughed and called the anesthesiologist into the room to give me more medicine. I freaked them all out again when I woke up while they were cleaning me up before they had even transferred me off of the operating table. The second time was last year when I had my port installed. I was supposed to be out thanks to twilight anesthesia, but it just didn't work on me. They wheeled me into the OR and we were all just waiting for it to start kicking in, but I wasn't even getting drowsy, so they gave me more. Still, nothing. At this point, we had been waiting for some time for me to at least get drowsy, but nothing was happening. So the surgeon had the nurse anesthetist call the anesthesiologist to get permission to give me even more medicine, including a stronger one that they don't normally use for twilight with these procedures. The anesthesiologist didn't really understand the fact that I wasn't asleep yet because she said no, because they would have to get the patient's consent. So they put her on speaker in the operating room so that I could tell her that I had consented. She was then quite taken aback but gave permission to use the medicine. I got all dosed up and we waited, but absolutely nothing happened. Finally, I just told the surgeon to get started. They use local anesthetic in addition to the twilight with these procedures at the local hospitals. But I metabolized local anesthetic so quickly that it lasts for a few minutes at most. Yes, dental work is about as fun as you would imagine. I felt everything except for the very first incision. The surgeon and I chatted during the entire procedure to help keep my mind off the pain and the discomfort. He said it was the weirdest, most terrifying port placement he has ever done, and he has done several thousand of them. Never with a patient awake and providing active feedback, though. Thankfully, these incidents taught me a lot about how I process and react to different forms of anesthesia. So now when I have surgeries or small procedures, I take in a paper that lists the different anesthesia medications that I have had weird or bad experiences with so that my surgeons are prepared. Story 17. There have been a few. For something I was doing personally, a kid fell on a broken coffee mug and had a tiny cut just below the sternum. I was just going to clean it and close it up with some stitches, but when I was exploring it, I found the internal damage was much more extensive. The oh crap moments I've seen when doing transplants. There are these things called life ports that are used for kidneys. They allow fluid to circulate during transport from the donor to the recipient. One surgeon I was working with dropped a kidney inside the life port onto the ground. Surprisingly, the kidney was okay. Another surgeon just couldn't get the life port to open. Getting frustrated, he asked for a mallet. He was going to bash it to try to open it. Story 18. Not actually during surgery, but I did vent house extraction, pulled the baby out with a vacuum cup, and even though there weren't risk factors for shoulder dystocia, the baby was stuck, really stuck. None of the standard maneuvers helped at all, so I did what you do next and grabbed the baby's hand and tried to pull one arm out, which usually helps. But this baby had its elbow stuck somewhere, likely under the mother's symphysis. So there I am, hand deep in, seconds ticking, and there are not many options left, so I pulled the hand, hard. So anyways, that was a nice build-up for the next patient of the night. My senior consultant went to do a manual placenta removal as I was stitching the shoulder dystocia patient. He called me to the OR and I thought they wanted to know how everything went. He was running to the birth, but we got the baby out before he got there. But no, he had managed to remove half of the placenta, which was a surprise, askreddit. He had grown into the uterine wall and his hand was cramping. That was when we started to think that we may have to remove something from the patient. In an effort to avoid having to remove something, I went to tear the rest of the placenta off and actually managed rather well. Story 19. I'm just an RN. I do some health. I was admitting a patient yesterday and his referral basically said this is a VIP. The surgeon wants us to be very accommodating. Now, this is weird. This isn't the kind of thing I get on a referral. So I get there and meet the guy who was incredibly nice. He just had a knee replacement, but he's otherwise healthy and functioning pretty well on his own. But midway through the admission, he gets a look on his face and asks, "Is it normal to hear things during your surgery? During a knee replacement?" "No, sir, it isn't." He follows with, "When I woke up the first time, I could hear banging in some machinery." The doctor stopped and looked at me. He asked if I was awake, and I told him I was. The doctor asked how I was doing and if I could count backwards for him. The next time they woke me up, I was in recovery. Oh, so yeah, this patient's anesthesia was too light during an ortho surgery. Those are rough surgeries. And he was awake enough to answer questions and count. This is why he's the VIP. It's honestly not the surgeon's fault, but damn, that's a bad day at work. Story 20. Not a surgeon, was just an LVN at the time working in a small town LTAC, what a med-surg unit used to be before insurance got weird. People stayed for between a week and 6 months or more to heal from whatever they had, lots of vents and tracks. I got a call from the local ICU that one of my patients was returning after being shipped out to the main hospital for a GI repair. The RN on the phone is giving me a report and offhandedly reports, "He was retching up a little this morning, but I've been checking his PEG, feeding tube, and there are no residuals, so I don't know where it's coming from. Must be reflux." So an hour or so, EMS rolls a guy in and he has retched all over himself during the ambulance ride. We set up suction to get it out of his track, and I noticed, this guy had been with us a while before his surgery, that his stomach is super distended. He was a big man, but not that big. I go to check residuals because I never trust reports, especially with evidence to the contrary right in front of my eyes. I attached a 60 milliliter syringe to the PEG and pull back and get a syringe full of air. Now, if you check residuals and the stomach is actually empty, you may get a little air before the tube collapses on itself and stops pulling back. Nope, full syringe of air. Empty the syringe and pull it back again, another full syringe of air. After this, I look at the EMTs and the attending, who was now in the room, and remove the end of the syringe. There was an audible hissing noise for a good 5 seconds as air escapes. The attending called the intensivist on his cell phone from the room. The intensivist was like, "LOL, no way my nurse would be that stupid." So the doctor sent him a picture of the canister. The intensivist sheepishly calls back and reaccepts the patient back to the ICU, where he underwent a revision and was back to us a week later feeling much better. I still have nightmares of that syringe filling up. Story 21. A patient once came by ambulance, too obese to move, complaining of a bad taste in her mouth. A surgery resident and I went to the ER to check on her, and she started giving us information. She mentioned feeling occasional belly pain, so we uncovered her to see what was going on. And oh my God, her entire abdomen was gangrenous. The surgeon immediately took her to the OR, where we began debridement. A medical student fainted. The debridement was so radical that when the time came to close the abdominal wall muscles, there were no muscle left to stitch together. We didn't have a vacuum device at the time, so we opened sterile IV solution packages like butterfly wings and stitched them to the remaining muscle and sheath. The surgery was completed and the patient was sent to the ICU. A day later, I was rounding on the patient. She was doing fine and then started coughing uncontrollably, tearing the stitches. It was so terrifying that I fainted. When I woke up, I learned that she had unfortunately passed away. I was a student back then, but it still haunts me to this very day. Yikes, when the human body decides to throw a surprise party in, it's not a good one. Story 22. So, this happened when my wife was giving birth. Naturally, it wasn't happening. The baby was way too big and my wife wasn't dilating fast enough. They tried an artificial dilation, the balloon method, I can't remember the name, and that didn't work. So they ended up having to do a C-section. They do the spinal numbing and everything seems to be going okay. I'm super squeamish and tell them I might have to leave. My wife, though, is really curious to the point where she's considering asking if they'll let her look over the curtain, until she says, "I can feel that," to the doctor. At first, he doesn't understand, so he asks, "You can feel this?" My wife, having extreme control, says more sternly, "Yes, I can feel that." In what feels like an instant, they have me out of the room and the anesthesiologist putting her under. Those doctors definitely had an oh crap moment. I also had an oh crap moment followed by hours of extreme anxiety because I saw neither my wife nor my baby for that time. Everything went well in the end, however. Story 23. I'm an anesthesiologist, and in my first year of residency, we had a young 25-year-old patient scheduled for a relatively harmless liver abscess aspiration. I was in my third month of residency and responsible for loading the medications needed to keep him anesthetized. After the patient was under anesthesia, we needed to turn him onto his side for better surgical access. One of the technicians was instructed to press a button on the remote control for the operating room table so that the head and neck would be on the same level as the abdomen. However, when he started pressing the button, it got stuck in the depressed position. The patient's neck immediately hyperextended and he went into cardiac arrest. I vividly remember this case as it was my first oh crap moment. All my attending physicians rushed into the room and started CPR, reviving him after 3 cycles. We suspected vasovagal syncope. My head of anesthesiology later referred the patient to a hospital with better facilities. Story 24. Not a surgeon, but a respiratory therapist. I've got a pretty bad oh crap moment that happened when I was still a student. So we had a guy who started coding a couple of hours after getting a thoracentesis. He's difficult to ventilate. I don't remember what exactly transpired, but next thing we know, there's red liquid everywhere. One of the residents was trying to put in a chest tube when he nicked an artery. Dude literally had his gloved finger plugging the hole. Finally gets the chest tube in and stuff immediately pours into the drainage system and it overflows within a minute. They normally fill over the course of hours to days for reference. Pretty much the whole damn room was filled, and shockingly, he didn't make it. Story 25. I'm not a doctor, but this happened to my wife, which I learnt about afterwards. My wife and I flew to Prague for her to have a facelift. The company doing it had great feedback, so all seemed good. The day of her operation, I was told to go back to the apartment and wait for their call. I waited and waited. I called them, no reply. When I did get an answer, the receptionist didn't speak English. The next day, I managed to get in to see her. Her bed was still covered in red liquid and her face was partially paralyzed. The oh crap moment was when they told me that during the facelift, the surgeon accidentally nicked the nerves on one side of the face, which would hopefully reattach themselves in around 6 months. She still has a nerve twitch there. But still, not the oh crap moment. That came when they said the surgeon also nicked the main artery in her neck and couldn't control it. So they had to fly another surgeon in from another country who could specialize in repairing the damaged artery. She almost passed away and had no one there who could deal with something like this if it happened. Story 26. Not a surgeon, just a med student. It was our first day of general surgery rotation and we were scheduled to first see a perirectal abscess. Nothing like the horror story a few comments above, and the patient was still awake given the epidural. It wasn't the worst of smells, just a teeny tiny subtle waft, but it was right after I just put in a Foley for the first time, with everyone looking at me minutes earlier, and I could feel a knot in my throat. I sat down against the wall, tried to steady my breath and calm down, but the knot just wouldn't go away. I ended up needing an IV, and seemingly I had really low pressure that day. This came after a few months before that I'd gone to donate, and the nurse told me afterwards that I should drink more water. I didn't really take the rest and take it easy bit of advice to heart to my shame, and later in the day, as I looked in the mirror, I could see myself whitening and my lips turning blue. Moral of the story, just drink that damn water. Story 27. Last week, I was performing a tracheotomy inside the ICU, double aprons, one of which is impermeable, a tight mask, glasses, hood. It's a bit uncomfortable, super hot, and actually makes vision a bit worse. Anyways, I've done a few by now. This guy, however, has a super short neck, fat and swollen. Tight space and difficult anatomy, everything I touched was chaos. I closed a huge amount of veins. It seemed like he had 8 anterior jugulars each side, a vein that we sometimes see during tracheotomy, 1 each side. So 1 or 2 days before this, I was talking to my father, and he was telling me how he thinks of his dad when he rides his motorcycle, and that makes him feel protected. He was a biker himself, my grandpa. Well, as I held a pack of gauze, compressing the wound and recollecting my thoughts, I caught myself doing the same thing my dad did, wishing his dad was there to guide him. Dad is an accomplished surgeon, but my dad is still alive, lol. So yeah, that was the most recent one. All ended fine with the procedure, though the patient has bad odds of making it through his disease, unfortunately. We do what we must. Story 28. Surgery resident in Taiwan. We are required to perform a 2-year rotation in all surgical fields before we choose a specific field to pursue as our career. This event happened when I was